Hello everyone, my name is Miguel Escalon. I'm a physiatrist at Mount Sinai Hospital in New York. I specialize in neurological rehab of persons that have suffered from brain or spinal cord injuries. So spasticity is a form of hyperreflexia. So we always have cortical or brain control over our reflexes, but after a brain or spinal cord injury, that control is lessened. So if you could imagine walking down the street and you go to step on a nail, your foot would jump up. You wouldn't have to think about that. But in truth, there is cortical control there. So if you were carrying, say, quadruplets, and you went down to walk down that same street, step on that same nail, you could imagine a scenario where your brain would say, the leg cannot jump back. You could drop these quadruplets, and so you have to walk through the nail. What happens after a brain or spinal cord injury is that cortical control is lessened or gone. And depending on where the injury is and how severe it is, you could have varying levels of spasticity in different limbs, which result in impaired function, stiffness, pain, and decreased range of motion. Spasticity can be good, it can be bad. It depends on the situation. Sometimes we can leverage spasticity for functional gain. In a person that has no strength, spasticity could help stand, transfer, and do different things. In other cases, when somebody does have underlying strength, the spasticity could be detrimental. Also depends if the spasticity is causing pain or if there are pressure injuries involved. Ultimately, spasticity is very patient dependent, and the way we would treat it really would require a specialist to decide. The development of spasticity is a normal process of damage to the central nervous system. So it's not a guarantee of continued recovery. However, the lack of development of spasticity in a patient with weakness or absence of strength is usually a negative prognostic indicator. So spasticity can be made worse by any stress on the body. Certainly that could be emotional stress or physical stress, but more importantly for clinicians, we look at physiologic stressors or things that could cause pain, pressure injuries, urinary tract infections, some other kind of infection or anything else going on like that. So spasticity can be helpful in the sense that it could be a proxy for a physiologic change or infection in the body. The natural course of recovery from damage to the central nervous system is increased spasticity initially. Spasticity usually doesn't go away completely unless there is full motor recovery. So in most instances, the spasticity will get better. There's no way of knowing without knowing if a person will make a full recovery if the spasticity will resolve. However, there's a lot of treatment options to help lessen or improve the spasticity. The management and the treatment of spasticity is multimodal and is interdisciplinary. So certainly if you have a patient with spasticity that's painful or limiting their function, a referral to a specialist in spasticity management like a physiatrist or rehab doctor, and referrals to PT and OT are a great first step. PT and OT can teach your patients how to a home exercise and stretching program to help maintain on their own. A physiatrist or a specialist in spasticity would evaluate for potential management with an oral antispasmodic or local antispasmodics such as botulinum toxin injections. If you have a patient with spasticity and you have a department of physical medicine and rehabilitation or a department of neurology, it's a great place to start to find someone that can guide you to the right person to manage the spasticity. As a secondary option, if that's not